Welcome to this second video on the Semmelweis story. Semmelweis's work was undoubtedly an important contribution to modern medicine, but if we set aside the hand-washing aspect of the story, we can ask ourselves some questions. How and why did puerperal fever arise in the first place? If we look at the history of the disease, we see that with the gradual move of populations into towns around the 17th century, the introduction of hospital wards intended for childbirth started to become common. The first recorded epidemic of the disease occurred at the Hôtel Dieu Hospital in Paris in 1646. Mortality rates for this disease in Europe and on the American continent were to remain consistently and overwhelmingly high. Puerperal fever arose from the unsanitary conditions and poor hygienic practices in these maternity wards and clinics. It was caused by Streptococcus bacteria infection, resulting from multiple vaginal exams, manual removal of placenta, or caesarean section. Puerperal fever was in fact a nosocomial disease specific to the hospital environment, transmitted mainly by male doctors, in an activity that had been historically female up to the beginning of the Enlightenment. Semmelweis's female midwife ward had a much lower incidence of this disease. To be fair to Semmelweis, we should look at the situation in systemic terms. He was both victim of a system whose inertia prevented acceptance of an important principle, but he was also a participant in a system usurping women's ancient role in assisting in childbirth, which was based on centuries of experience. So how and why did men get involved in midwifery in the first place? As is evidenced in many paintings and sculptures, from the earliest times it was women who supported women in childbirth. We have little documentation on the methodologies of midwives before the Enlightenment, mainly because their status did not allow them to learn how to write. Over centuries, women inherited medical skills and herbal knowledge from their mothers and grandmothers, and sometimes their role as healers clashed with that of male doctors. Because of this, many women became victims of witch hunts in Europe and later on the American continent. As an indication, one estimate says that up to 25% of women accused of witchcraft in New England had practiced some form of healing. In the early years of the Enlightenment period, physicians in general were reluctant to intercede in the birth process. Accompanying the mother-to-be would often be a time-consuming process, which would take away the doctor's time from other patients, hence reducing their income, which relied on patient fees. As an indication, medical practitioners in 17th century Britain fell mainly into the following categories: physicians, apothecaries, barber surgeons, midwives, and diverse other non-conventional healers. Physicians and apothecaries usually had a higher education, often at one of the famous universities on the European continent. They had little physical contact with their patients, at most examining their pulse or their urine, while prescribing herbal medicines or treatment with leeches. The barber surgeons and midwives, on the other hand, tended to acquire their skills by following older practices. They had a much dirtier form of work, dealing directly with the internals of the body and its fluids. In reality, there was some overlap between these different roles. The role of male doctors in childbirth began to change, when in 1663 the surgeon Julien Clément was asked to assist in the delivery of the first child of Louise de la Vallière, mistress of Louis XIV of France. It then became fashionable at the French court to have male assistants at birth, and the term accoucheur came into usage. Another factor that changed the physician's role was the appearance of books of instruction on assisting in childbirth. One of the first was Traité des maladies des femmes grosses et accouchées, written by François Morisot in 1668. Another important landmark was the invention of birthing forceps by members of the Chamberlain family, who kept this discovery secret for over 100 years. This story deserves a video to itself. The forceps were particularly important in those times, as many women in cities suffered from rickets. This disease deformed the human skeleton, and in particular the pelvis, making childbirth more difficult and dangerous. Birthing forceps were able to help considerably in these and many other situations. On the other hand, as midwives were discouraged from using instruments, this enhanced the status of male doctors in the area of childbirth. One of the most influential male obstetricians of the 18th century was William Smellie. As a note, the word obstetrics only began to be used in the early 19th century, but I will use it here for convenience. Smellie was originally an apothecary in Scotland, who began to read medical books to learn obstetrics. He assisted in hundreds of births in his native Lanark between 1722 and 1739, and then opened up a practice in London. In London, he provided services for impoverished women, in exchange for allowing his students to practice on them. He observed many conditions, and on the basis of his prolific notes, he wrote his 3-volume treatise on the theory and practice of midwifery. He separately published a set of anatomical tables with illustrations to complement this treatise. He became very popular, and in his London practice he delivered 280 lecture courses and had over 900 students. He used models in his lecture courses, and his education included how to interact with other midwives, appropriate bedside manner, and how to handle patients and their families in general. In particular, his style of writing appeared to make the male accoucheur into a hero. In 1785, the British surgeon Thomas Denman wrote an introduction to the practice of midwifery, which became the standard obstetrics textbook for the first half of the 19th century. Again, his manner of writing promoted the notion of the doctor as the well-educated, well-bred gentleman who intervenes only in emergencies. In the United States, Samuel Bard, who founded the first hospital in New York, wrote a compendium of the theory and practice of midwifery, which became the basic textbook for American obstetricians. He later became personal physician to George Washington. In a subtle way, all of these textbooks were dismissive of the apprenticed education and skills of female midwives. In parallel, a number of women midwives also became notable, and some of them fought back. Justina Siegemund was a Silesian midwife whose skill resulted in her becoming the city midwife of Legnica. She saved the life of Louise, Duchess of Legnica, when she developed a cervical tumor. When accused of unsafe practices, she was actively defended by other male doctors. She served as court midwife in Berlin and wrote the book The Court Midwife, an authoritative text which dealt with many complications associated with childbirth. Sarah Stone was an apprentice to her mother, who also happened to be a midwife. She married a surgeon apothecary, which gave her access to medical literature. There were no man midwives in Somerset where she practiced, which meant that she had to deal with many emergencies. She rarely used tools or instruments. She wrote A Complete Practice of Midwifery, a guide which described 50 of her most challenging cases. She criticized man midwives as being unable to understand women's pains. Angélique Ducoudray was born to a family of physicians. She became the head accoucheuse at the Hôtel Dieu Hospital in Paris. She invented the first life-size obstetrical mannequin to help students in the practice of childbirth. Louis XV commissioned her to give courses everywhere in France. She wrote an abridgment to the art of delivery, which was translated into many languages. The cause of her death is unknown, but the French Revolution contributed to her downfall, and ironically strengthened the role of the male accoucheur. As a postscript, right up to the 1970s, women only constituted a small percentage of medical students in the world. By 2019, women comprised over 50% of all medical students in the United States. Most have specialized in obstetrics and gynecology. About 8% of US births are currently performed by midwives. This percentage is much higher in other parts of the world. A look at how male artists observed male and female midwives is very telling. First, if we look at the posture, we can see that male obstetricians are invariably portrayed as standing, often in a position of discussion, implying learned reflection. They're handsome, elegantly dressed, and have little physical involvement with the mother-to-be. When active, they appear to be calm, staid, and in control. This is in comparison to female midwives, who may be struggling or in a situation of disarray. If there are other women in the picture, they're usually performing some menial task. Women are rarely standing, and more often on their knees or bent in effort. If old, they come over as ugly rather than wise. If we take another look at this statue in honour of Semmelweis and apply some of these observations, we could make further interpretations concerning the role of male obstetricians with respect to female midwives. In literature, Charles Dickens didn't do midwives any favours with his character Sarah Gamp in his 1844 novel Martin Chuzzlewit. Gamp, who is equally enthusiastic at laying out a corpse as she is at delivering a baby, becomes a stereotype for untrained, incompetent nurses and midwives. As a final note, more important than the feminist aspect of this story should be a reflection on the role and interplay of yin and yang. Yin here is represented by female midwives, tradition and apprenticed experience. Yang is represented by the male obstetricians, science and experimentation. I will leave it to you to ponder over this, and you can leave comments below. Thank you for watching this video, and I hope you'll join me for other videos in this series.